Welcome to the Village podcast. I am your host, Nicole Trumpio. My why has always been to empower women and amplify the voices of mothers. We created the Village to share stories and ideas to embody the innate wisdom of a village, but on a modern day platform. I hope this podcast inspires, educates, and informs you and brings you the joy, love, and light you deserve. Welcome to the Village. Today we have a very special guest. He is an angel in Los Angeles. Everyone knows him as the baby whisperer. He has served many women with all of their pregnancy pains and postpartum, and has a fan club of celebrities who also frequent his office. Dr. Berlin is a chiropractor, masseuse, turned doula, which is very interesting. We're going to get into that a lot more. We're going to talk today about his start to his career, how it progressed, and also we're going to touch on flipping babies, which I'm really interested to learn more about. Dr. Berlin, welcome to the Village podcast. We're so happy to have you today.
Thank you, Nicole, for having me, but also for that introduction. Wherever I go, I would love to bring you to make that introduction before I start talking. I can't even wait to hear what I have to say with an introduction like that.
Well,
thank you.
Like it's really interesting for me as a mother and a business owner serving women going through this incredible transition. And I'm so excited to talk to the doctors in our community, and in particular you, because you do something that's so special. I feel like you can't even put a label on it. It's very unique. Mm-hmm. And you just really feel that the moment that you step into your office and in your presence. It's a whole different kind of wisdom that you're offering. It's not just, this is a handbook on something I learned in school and now I'm practicing it. Mm-hmm. It's this kind of holistic wisdom that you're pulling from like multiple angles. So I'm really curious to know how you got your start in this.
I was very young. I walked into a building in Manhattan with my family, and there was a CPR class going on. Mm. And I was mortified. I'm like, what are they doing to that poor woman with no arms and no legs? And they were like, oh no, you could use your body to like be her heart and lungs for a little while, and until advanced medical care can come. And it just blew my mind. The fact that one human could kind of use their body to help another human in that way for survival. I just knew right then and there, healthcare. I'm going to be in healthcare. That was the first big arrow that popped up.
Wow.
I fell in love with everything healthcare oriented. I started doing classes a few years later with the Red Cross. I did CPR and first aid and responding to emergencies. I became a EMT and started working in ambulances and emergency rooms when I was 18 years old.
Wow.
And I was really medicine. I was going to be the best surgeon, doctor there ever was. Oh. In college, I was starting off pre-med, and my father suddenly died partially from a medical mix-up. And it was really traumatic, and I still loved medicine, but I wanted to be, I thought, not in the drugs and surgery space of healthcare, but more working with the body and not working against it. And I have deep respect for medicine, surgery, drugs, all of it. But after college, I took a year off, and I just researched a lot of different forms of healthcare. And I fell in love with the combination of massage and chiropractic together, working the musculoskeletal system, protecting the nerves, helping the body heal itself. And I went to school for both, and I smushed them together to make the sort of chocolate and peanut butter of holistic healthcare.
Which is so interesting because it makes so much sense, right? But it's still not really merged.
Right. You have one set of people who do the soft tissue, the massage, and another set of people who do the bony tissue, the chiropractors doing adjustments.
Yeah.
I love smushing them together because you have a deeply intertwined musculoskeletal system. It's not like they're separate from each other.
For sure. And I feel like when I go, if I have some kind of pain and I go get a chiropractic adjustment, then I still have the pain, and it's muscle or vice versa. So it's really interesting that you started that way, and also just really tuning into the body, right? Because it's so out of the box, but it's so natural.
It gives me a lot more if I would just do adjustments. And adjustments can be really powerful and helpful for certain people, certain times. And so can massage without adjustments. But when I combine them together, I really get to spend time with my patients and to be in touch and to really diagnostically get a great sense of what's going on all throughout the body. Holistic modalities are like that. There's the saying that when you step on a dog's tail, it barks. And so allopathic medicine, drugs and surgery medicine generally zeroes in on the symptom. What's going on right over here. But in the case of the dog, you'd like anesthetize the vocal cords and the dog would stop barking, but there's still somebody stepping on their tail.
Right.
So in holistic medicine, we zoom out a little bit. We look at the big picture. We look at you as a whole organism, your mind, your body, your spirit, your nutrition, your relationship, everything that has an impact on you.
Yeah.
And we take all of that into account when sort of assessing what's troubling you and how to remedy it.
Right. So out of school, you decided to start your own practice. Is that right?
Yes.
Right out of school?
Right out of school.
Yeah. And then you met your wife, who's also, we interviewed her also. She is a perinatal psychologist. So
Yes.
you guys are kind of like the dream team.
We worked together. We went to grad school together in Georgia, and chiropractic and psychology. So we started a book called A Shrink and a Quack, and a guide to like life. And so in that way, we were thinking very similar, you know, and then we realized they're the same. Like the mind is the body and the body is the mind. And in that way, addressing it from the more physical and the more mental elements, we could be more holistic. It wasn't until we tried having kids.
Yeah.
And, we followed the instructions. We said, okay, look, we're done with grad school. It's good time to have a kid, start a family. And we followed the instructions and no baby came out. And, we went for medical help after a while and still no baby came out. We were young, 25 and 27.
Yeah.
We did years of fertility treatments. And at the end, they just basically said, we don't know why, but we don't think you'll ever have kids together. Like, look at alternative pathways to parenthood.
Yeah.
And I didn't even know what that meant exactly at that time. But what I did know is we were broken. We had the relationship on the rocks. It's just a heavy roller coaster, that whole fertility journey. And we spent all our money on it. It was intense for her, all the medical interventions and treatments. And we just had nothing left. So, and as individuals, we were falling apart. So we just decided, hey, we're young, let's take a little break and just get ourselves healthy. Like we were living in Nebraska then for her internship, and we spent a lot of time working on our relationship, going on these hours and hours long bike rides on these beautiful groomed trails in Nebraska. And we started to eat better, exercise a bit, earn money and not spend it on fertility.
Yeah.
Things were feeling a lot better. And we moved to Los Angeles and we said, okay, maybe now we should start talking about alternative pathways to parenthood. And we found out we were pregnant.
Wow.
And then every 2 years, another baby came out. Like we couldn't turn it off.
Wow. So what do you think that shift was then?
I think that it's hard to say. There's so many possibilities, but I do have a strong feeling that when the nervous system feels safe, then it supports pregnancy. It tries to promote and help all the different steps that have to come together from, creating healthy follicles and eggs and merging them together and nurturing that young embryo until it grows a placenta. And if the nervous system feels like there's an emergency going on, it's almost the exact opposite. The body will try to foil that pregnancy wherever it can. Because, having a baby is not an emergency function.
Right. It's like when your body's in fight or flight mode.
Exactly.
Right.
Exactly.
It's so interesting because I had a friend that was trying to get pregnant for so long, similar story, and then just kind of gave up on the process and was like, you know what, this is not my journey. And then she went home, she's Australian, just to spend, months at home. And she's like, she got pregnant. And it's like home is the place that you feel the most safe. So when I hear you talk about like the nervous system being maybe a factor in fertility,
yes,
it's like, I think us all feeling safe is like, it's creating space for these things to happen, right?
Absolutely. And who feels safe today? There's so many things, like you just, if you turn on the news or you go outside, I mean, there's just so many things. Work is stressful, family is stressful. And, you know, the autonomic nervous system, the part of your nervous system you don't think about and control consciously, is all of your organs, your heart, your lungs, your blood vessels, your liver, and what happens is they have two different modes of operation. It's a spectrum, but on one polar end, you have total rest and relaxation. On the other one, you have total emergency. And there's everything in between. So if you're just sitting at the pool, you know, with your favorite drink, perfect weather, reading an amazing book, that's all the way down here. We call it the feed and breed part of the nervous system, or mode of function, or parasympathetic. And then if all of a sudden you hear rustling in the bushes and you look up, and you see a mountain lion charging towards you, you don't have to think about it. The changes take place automatically.
Yeah.
Your heart starts pumping differently. Your breathing changes. Your blood flow goes from your postural muscles into your arms and legs so you can run and so you can fight. Your pupils dilate so you can see the battlefield. Everything becomes really sensitive.
Yeah.
So that the second something touches you, you know about it and you can react to it. That's the sympathetic or the fight or flight mode that you're talking about. So it's the same organs under a different mode of operation. Now, those outside stimuli are what we're supposed to respond to, fight or flight, and give us like survival. But sometimes it's internal stimuli. It's strife on the inside. And it doesn't have to be the full exaggerated fight or flight response. It could be the thermostat on the spectrum is just a little bit higher towards emergency mode, even when you're at rest. And those things happen continuously, a little more than they should. Your pupils are always a little open more than they should. You're breaking down sugar at your liver and bringing it to your arms and legs so you can fight more than you should. The blood flow diverts away from your posture into your arms and legs.
Yeah.
And when those things happen, you get predictable symptoms, right? Sometimes with all that stimulus coming in, you'll be prone to headaches. Or if your blood is going away from your posture into your arms and legs, you'll get neck pain, shoulder pain, back pain, hip pain, sciatica, things like that. And the thing that happens digestively is your body doesn't really focus on your digestive system or your reproductive system, because when you're being chased by a tiger, it's not a great time to stop and have a donut or have a baby. So
definitely not.
Those systems get either shut down and in fact, when someone gets really scared, right? Sometimes they wet themselves or poop their pants. That's the body just letting it all go,
right?
And focusing on the next thing, shutting down that system.
I mean, it makes perfect sense. Is that something
too.
Like, do you work with women who are on a fertility journey?
Yeah. So after Alyssa and I succeeded, not even with that mission in mind.
Yeah.
We just wanted to fix ourselves, make ourselves stronger, healthier, feel better, and then found out we were pregnant, and then just never did fertility work again. Just every 2 years, another kid with 4 healthy kids, thank God. It was sort of like we went into mind-body practice together with an eye. I mean, it was for like general health and wellness, but with an eye on helping people boost fertility. And, that's how we got into pregnancy care, is the success of that program. Just, the first year, a couple of babies, second year, a couple more babies. And before you know it, it was just raining babies everywhere. And we ended up doing prenatal care. And it's good too, because the fertility journey is such an emotional roller coaster that to really be able to provide good support and care for somebody on that journey, it takes a lot out of you as a provider. Yeah. If you have 30 people trying to get pregnant, pretty much every month you get that dreaded phone call, I got my period, it didn't work out this month. And it's just, you want to give them everything. It's so draining. You go home and there's nothing left. Yeah. So we still do that And we don't advertise anymore. We just have a handful of couples at a time or individuals at a time who are going through the process. And we see them on the down low.
Yeah.
And we can have enough energy for them and enough support for them. And, you know, most of our day is filled with like the joy of pregnancy and people happy to be pregnant and having babies. So
right, because that's the bread and butter of your work.
Totally.
Yeah. So on that journey, obviously you're looking at the nervous system, right? But traditionally, are doctors looking at the nervous system when they're kind of diagnosing infertility, or not really?
Not really. They're looking, again, allopathic medicine is much more focused on zooming in. So, you know, they want to see how your blood chemistry is. They want to see how your hormones are doing, your fertility hormones. They want to see how the organs are doing, the ovaries and the uterus and the fallopian tubes and things like that, which are all very important, but they're not the whole picture.
For sure. So do you find that you have people, the small like group of people that you work with, do you find those people are not having success with the medical fertility?
No, it's sort of like chiropractic and massage where one can help some people and the other can help other people.
Got you.
And the combination may be more powerful.
Yeah.
People do fertility treatments all the time and they're successful.
And they're doing it in combination with what you guys
Sometimes yes and sometimes not.
Got you.
And sometimes people just come in and they're not ready to do medical fertility and they just do the stuff that we do. And they'll end up in a better place and get pregnant without doing it.
I think it's just really cool. Like I love your story because it's really cool to hear that. I've never heard that before. And for our community, just to hear that that's something to consider. It's not going to work for everybody, but it's a really cool thing to consider when you're looking at getting pregnant as well.
Totally. And you'd want to do it anyway. Who doesn't want your nervous system in a more settled, calm, relaxed place 100%. For pregnancy, even if you're fertile myrtle?
Or even like for life.
Yeah.
Throughout this journey, you made a decision to become a doula. And for those that are listening right now that don't know what a doula is, can you describe it?
Yeah, the first time I even heard that term doula, I was like, Gesundheit. I don't know what that means. And then now I am one. It's a doula is, well, let's go back. If you go back babies being born in hospitals. They were born at home. They were born on your family property in your village. You were surrounded by people who you saw pregnant, you saw and helped when they gave birth and fed their babies, and they reciprocated when it was your turn. And if you look at all those old pictures of people giving birth, that's what it is. They're surrounded by village and community and almost entirely women. Today, it doesn't work that way for most people. We've sort of moved away from our families. And we don't live on the property in the village. And when it's your time to have the baby, you probably haven't had that much exposure to pregnancy, certainly not birth and maybe not breastfeeding. And there's not all those people to support you. Yeah. And so the lack of sort of knowledge and experience and comfort with those things and the lack of support with those things makes it a lot harder. So some of those supports have been replaced with professional jobs, and one of them is doula. So we have childbirth educators that do all the teaching because you don't have that exposure. You don't have your family in your ear. The doula is somebody who during pregnancy generally helps educate, point you in the right direction of information, help you sort through the different choices that you might have to make during pregnancy and during birth and after the baby arrives. And then there's a bit of an advocacy role for them. Sometimes if you're at a birth and there's a setting where other people are making choices or serving them, the doula might help them find their voice or jot down their thoughts on how they'd like this birth to go and share that with the birth team. But in labor, it's all non-medical support. So doulas don't have any medical training. They don't do like exams and they don't do treatments or interventions. It's support. And the way I see it is, the birthing woman is very powerful and has all of her information on how to do this stored deep inside. But sometimes there's a lot of rubble that covers up that voice. It's very muffled. It's to try to help her hear that voice, find her strength, feel safe, feel comfortable, and to use that safety, comfort, and power to do this incredible thing and bring the baby into the world. I became a doula sort of by accident. I do massage and body work with pregnancy all the time. And I just one time got called to a birth where a baby was sort of stuck, not really positioned well, not making any progress. It was a home birth. She was maybe 9 centimeters for 7 or 8 hours.
Wow.
And the midwife called and she's like, you know how sometimes you open up the pelvis with massage and adjustments. And anyway, I have a client for you. And I was like, okay, I have an opening on Tuesday. She's like, no,
like
I need
right
it
now.
right now. You know, I remember we were at Petco trying not to buy this guinea pig for my kids. And I just went down there and it was bizarre. It was my first time at a birth of a kid that wasn't my own kid.
Right.
With people I never met before. I'd never met this couple.
Yeah.
And nobody told me they were filming for a documentary. So there were like 6 cameras around the room. And when I first started, I was like, how does my balding spot look in camera number 2, you know? And I couldn't focus on anything. And then I tried to do informed consent, and this was the craziest thing. I was explaining, hi, I'm Elliot Berlin, and she's like, I know, I love you, Mr. Berlin. I'm like, okay. And I was just like, I want to do massage to loosen things up. I want to do adjustments to get more functionality into your pelvis.
Yeah.
Would that be okay? And she said again, I love you, Mr. Berlin. And I'm like, does anybody know if that constitutes informed consent?
Yeah.
So, long story short, we did it. We did body work and she was super tight.
Yeah.
She was, my point about her is she was high on drugs that she made herself, like her own self-generated drugs. And I was told, because she had been in labor for a long time, that at the beginning she was quite nervous and anxious and having a hard time tolerating the surges because they were intense. And it took time for her to like relax and settle into it and start making these powerful drugs that you guys make. And she just literally was high on her own drugs. And she did start loosening up and opening with the session that we did.
Right.
And I could feel her getting looser and looser. She can kind of become more and more relaxed. And there was a moment where she goes, I think you just saved my birth. And the baby just clunked into place. And then it was sort of like taking a car that's in neutral and putting it in drive.
Yeah.
Then all those contractions weren't just stepping on the gas and revving the engine. They were making a difference. And about 40 minutes later, her baby came out.
Wow.
And it was then I started getting phone calls. Hey, can you come to this birth? Can you come to that birth? And I just ended up at a bunch of births where I didn't even feel comfortable. Sometimes I got left alone with a laboring person I never met before.
Right.
And things will start to pick up and she'll say, hey, you know, say something useful. And I'm like, I just rub things and crack stuff. I don't really know, you know. So I was like, maybe I should do doula training just to have more tools to be in that
just
environment.
Just add another thing.
So that's, I did doula training with my wife, actually. I think we might be the only husband and wife doula couple. And it just became, you know, as part of the training, you have to do some births as a doula.
Right.
And then I started doing births as a doula. And nobody wants this guy at their birth, really, except my wife. They want this guy. So it's all about the body work for me. You know, people just want my hands. Yeah. And it turned out to be quite amazing. And it really, I think, gave me perspective to help people during pregnancy to get ready for their birth.
Oh, yeah.
By having that kind of exposure and seeing different settings.
I mean, it's like, there's a couple of things here. I remember my first birth. It was a home birth, and I got a doula and I got a midwife, and my sister had told me stories because she had 2 home births about her doula pressing this pressure point in her back, relieving the pain.
Yes.
Right? And I was thinking the whole time, I was like, why isn't she pressing this pressure point that I didn't know about myself because I didn't educate myself? I just thought she knew and that she was going to
do
press
everything
it.
for you. Yeah.
That I want to talk about that pressure point, and because I felt it the second time. My friend was at my house when I was laboring, and she had done doula training before, and so she just pressed this pressure point, and I was like, oh, it was like an instant relief.
Were you having back labor?
I'm not sure.
Did you feel your contractions in your back in addition to over here, or were they just in the front?
I don't know. I think I've blanked it all out.
Oh, yeah. Okay. My guess is you were having some back labor.
Yeah.
So when your uterus was contracting, it was pushing back against your sacrum, the foundation of your spine.
Right.
And when it gets pushed back like that, it can feel like it's going to break in half. And doing a little counter pressure against it to just keep it in its zone instead of out of its normal range can make a huge difference. That back labor is not like traditional labor. You know, the contractions have a feel to them that's sort of normal. And back labor is not like that. It's a much more intense, for most people, much more intense sensation.
Interesting.
And if you can counter pressure against that sacrum during the surge, it could make a huge difference. In fact, my wife had that with our first, and it was a 42-hour labor. And, you know, this is long before I was a doula. I didn't really know that much. And I just found that pushing on her sacrum was helping her with the surges. And then, you know, it was a long labor, and she would wake me up every 8 minutes. She's like, push on that thing. I'm like, oh, okay. You know, and it helped. She did a 42-hour unmedicated birth, except for there were 400 milligrams of Advil, which I actually took for my terrible headache. And then I was like, baby, I have no idea how painful this is. Yeah. But she managed to do it with no meds. And, you know, it's just, that was a thing that really helped her settle into. It's hard to relax when you're feeling like you're breaking. Absolutely.
I mean, I think the back labor was definitely that for me. You know, on the second and third, that pressure point that you talk about for me was the difference between like wanting to have an epidural and not. Mm-hmm. And to know these pressure points, like I'm sure there's one for, what's the other version? So you've got back labor and...
Oh, typical labor here.
Yeah. What's the relieving factor
there? There's actually, I use a point in the shoulders for that, even though it's not right over here. That sometimes helps people really relax. There's a lot of different spots that can help. Some of them with fear, like in the feet. Yeah. Some of them with like your jaw, like if your jaw's super tense, then it also makes your pelvis super tense. So sometimes just releasing here can help you release over there. Yeah. One of my favorite things is to walk into a birth where someone's struggling with the surges. They don't have the confidence. They feel like this is stronger than I am. You have this strength and this power. And so if I can help her find it. And I just remember one home birth I went into and she was struggling, and every time a surge came, her whole body would tense up and she would fight herself. And remember we talked about fight or flight before. One of the things that happens when you're in fight or flight is you become much more sensitive to things that might be danger for you, like pain. And your pain is not just there, it's magnified many times. Yeah. And the perception of that pain is much more intense because your body wants you to run or fight. Yeah. And sometimes in this one in particular, I just took a foot. We never even talked. This is a birth I was hired to come to. She wanted me to come. She knew I was coming. And when I was there, I just came in and I saw, like, when she was fighting herself, how violent that looked. And I just took a foot and I didn't even talk to her. I just started doing reflexology in her foot. Fear points in her foot, points to, there's like a homunculus in your foot, a map of your whole body. So sometimes you can sort of get a little massage in your whole body just by working on your foot or working on your hand. And she started to relax and she started to calm down. And I got into her like leg, her calves and things like that. And I remember the first time a surge came and she was sort of almost asleep and she didn't have enough time to jump up and fight her surge. And she's like, oh, I can do that. And she realized that when she doesn't fight it or when the nervous system's in a more relaxed state, then it's much more tolerable. And with that, she was able to build confidence. And, you know, the next one came and she wasn't afraid of it. She's like, I got this. And she was able to breathe through it and surrender to it and let it do its job, you know? Yeah.
It makes perfect sense. It's kind of like you can also relate it to everything in life in a way, right?
Oh, sure. Yeah. Everything that, you know, you feel like you can't do.
Yeah.
And you take a minute and pause and center yourself. You can do a lot more than you think. But I didn't stay to the end of that birth. But once she was I was there for a couple hours, and when she was on a good pace, she finished.
And had you worked with her before?
Yes, during pregnancy.
So were you kind of informed by the points that would serve her from working with her before, or is it on the day it just kind of you just do an evaluation and test points?
There's both.
Yeah.
If I know somebody has a previous injury, sometimes that spot will act up during labor.
Yeah.
If I know what feels good to somebody, it may feel terrible to somebody else, but I get a sense of which spots help somebody relax or make them tense, or if they're ticklish in an area, that could also make them tense. So I learn a lot about, again, as an organism, the whole person. But there's also a big component of in the moment, because in the office you're on a table, we can position you in a way that's great for us, and we can get through all the different muscles and all the different positions. But in labor, you're sitting, you're on your side, you're in a tub, you're on a ball, you're on a stool.
You're like, can you come over here so I can adjust you? I need you to be in this position. She's going to be like, hell no.
No, it doesn't work that way. So depending on what positions people are in, I can get into different areas and work on them. And also some people who you think are going to love massage, there's a point in labor where they just become too sensitive and don't want to be touched at all.
For sure.
And it could be actually, I've been many times where I'm doing a trigger point or a massage and a surge will come and they won't even have time to tell me. I just smack my hands off. And then the second it's over, like, get back in there, So you just don't know. You have to roll with it in the moment.
Yeah. This episode is brought to you by BUMPSUIT, the modern company redefining maternity and beyond. As a mom of 3, I've tried every single baby carrier on the market, and at BUMPSUIT, we came up with the best baby carrier out there. We took all the problems from the baby carriers we loved and we solved them in this one baby carrier called the Armadillo. The Armadillo has a lot of different pockets for your phone, your keys. It even has a space for your water bottle to hang from. It has a weather cover. It's got a back lumbar for that support, especially after giving birth. It is great for newborns up until, my 3.5-year-old still asks for it. Go to bumpsuit.co. That's bumpsuit.co. Use the code THEVILLAGE20 for 20% off your entire order and get an Armadillo baby carrier. Do yourself a favor. I remember going into your office and I was suffering from a lot of different back pain, even acid reflux, right? Mm-hmm. And every time I walked out, I was like, and I felt at ease and like I was floating again. And so you really help a woman's body during pregnancy on so many levels. Then now during birth, I want to talk about something that I don't have any real knowledge of, but it's an interesting thing to me because a lot of women have this dream of having a natural birth and then their baby becomes in breech position. So you're one of the people that actually flips babies manually. And I remember my daughter was in a breech position and you gave me this sheet of paper and it looked like a yoga move. It was like, go upside down on like a couch or a chair and then stand up really quickly. And I did it over and over again. And I remember that exercise worked for me. Can we talk about this exercise?
So it's a little bit of a misnomer. I don't manually flip babies.
Okay.
I help create an environment in which babies should want to go head down on their own and in which your body should be able to better accommodate that move if the baby's trying to go. So if I can back up a drop, my premise is that babies want to be head down at the end of pregnancy. And that's based on statistics from a first pregnancy. In a first pregnancy, around 28 weeks into the pregnancy, 50%, half of all babies are not head down. And then 4 weeks later, at 32 weeks, only about 10% of babies are not head down. So there's a massive migration down between 28 and 32 weeks. And that coincides with when they start to run out of room in the womb. They can't just keep moving head up, head down, sideways, transverse, right? At 28 weeks, it's not that 50% of them are head up and 50% are head down. They're in motion. There's a lot of room. They're exploring. They move around a lot. By 32 weeks, only 10% of babies are not head down yet. And at birth, well, from 37 weeks on, so term, it's only 3 to 4% that aren't head down yet. So based on those numbers, that progression, the premise is babies want to be head down at the end of pregnancy. And if they don't go there, there's usually a reason for it. It could be structural things. It could be functional things. It could be a combination of both. So structural things might be, well, the top of the uterus sometimes has a variant shape. Instead of being rounded, it could have a little divot there, a little septum. They call it the heart-shaped uterus and sometimes the head will get stuck in one lobe of that cartoon heart and the legs will get stuck in the other side. And when they try to move, they can't really move past that little wall that most people don't have. Sometimes the placenta is right there in the front and the head will be on one side and the feet on the other side and the placenta gets in the way. Sometimes the umbilical cord's really short and the placenta's up high. So as the uterus keeps growing further and further away, so does the placenta move further away and the baby will turn to be up near the placenta and get all the snacks and meals. That's what I would do, frankly. So I think all of us. So sometimes the cord is long and it gets wrapped around them. Kind of funny from all those movements earlier on.
Yeah.
Fluid makes a difference. The normal amount of fluid in there is a very big range. And on the lower side of that normal range, there's not so much fluid. So it could be harder to move around.
Yeah.
On the higher side of that, there could be so much fluid that the baby's, even at 35, 36 weeks, doesn't have an incentive to move down because they haven't run out of space, especially if you're tall. So there's a lot of different factors. All we do is try to work on the functional side where your body's supposed to be very loose, relaxed, and open around your lower back, your hips, your pelvis at the end of pregnancy. Your body does that hormonally with hormones like relaxin and other hormones that kind of settle things down and loosen them up. But if your muscles and tendons are very stiff and tight, or where the bones come together, there's not great movement. They're kind of stuck together. You know, your pelvis is not a big solid bone. It's a bunch of bones connected by soft tissue. It should be able to expand and contract and kind of accommodate the baby's movements or even facilitate the baby's movements. But if everything's super tight and stuck together, then it just resists the baby's movements.
Right.
And so what we do is we try to take that environment, remove the restriction in the soft tissue with medium to deep tissue massage. And if the bones are not moving well, adjust them and restore motion between the bones around the joint. Make a musculoskeletal environment where when the baby runs out of space, instead of wanting to go under the ribs where there's more room because it's so tight here, open this up and give the incentive for the baby to want to move head down. And then your pelvis to be able to accommodate that movement if they're trying to go. Now, if there's structural things in the way, if the cord is short, if the cord is wrapped around them funny, then they probably won't go and we don't force them to go.
Okay.
Doctors could force them to go, medical doctors, but it's not something we do. We work on the more holistic side. The exercise that I gave you and the exercises in general are more positional. So if you think about sometimes you park into a parking space and you're crooked. To fix it, you kind of back out and then go back in. So sometimes the baby will be settling the wrong way, you know, not head down into your pelvis. And so those positions kind of help with gravity for them to back out, get that butt out or the feet out, and then, you know, go park the other way. And they can be very helpful on land, in water. People do them in the pool sometimes.
Yeah, it makes perfect sense on that level. Like, it was really easy for me. It just felt like a part of, you know, my care with my pregnancy. So what happens? So if someone does the exercise like what I do at home and it doesn't work, then they would, well, at your office, they would come in for a massage and you would just be trying to like really open things up.
Yeah, nothing to the baby. Everything we do is to the mom. Her body happens to be the baby's studio apartment. So making changes on it could have positive effects there. But all we're doing is musculoskeletal improvements to her body and seeing what the baby does. There's also like a Chinese remedy, which is moxibustion. It's instead of needling the points like acupuncture, you gently warm them with these herbal sticks that have a relaxant herb in them. And you do it by the feet, which is where the uterine points are. And it gently brings more blood flow to the uterus, and you start to see the baby start moving around a lot. So I'm creating more functional space. The Chinese medicine creates more movement in that space naturally. If those things still don't work, you could go with generally a medical doctor. Some midwives do an external cephalic version. It's called the ECV. So usually go into the hospital and they monitor where's the baby at. And let's say the butt or the feet are down here. They force them out. They try to push them out. With
what?
With their hands.
Like just on top of your belly? Okay.
Yeah, through your belly. It's external, but they put a lot of goop on you, so you're like glidey.
Yeah.
And they push up, and sometimes it's another doctor who's pushing the head the other way.
Yeah.
And they try to manually move the baby. If it doesn't work, they'll try the other way. Maybe 3 or 4 times. If it still doesn't work, then you're stuck breech.
Oh, I don't know about that.
It's intense. I mean, look, there's a lot of factors. If it's your 3rd pregnancy, you already had 2 head down babies, you're tall, you have a ton of fluid, and the baby's been flip-flopping, that procedure usually goes like that. If it's your first baby, super stiff, super tight, baby's been stuck in that breech position since week 20. And, you have low amniotic fluid and you're a short torso, I would bet every dollar against it working for you, and it would be pretty intense. Now, sometimes they do it with an epidural, but it's like...
Wow. Is there like any kind of complications around flipping a baby?
When you manually flip a baby, there are risks. So for one thing, the water could break, right? So if the water breaks and the baby's still breech, most doctors don't deliver breech babies vaginally. So that would be a fairly quick cesarean birth. There are a handful that still deliver breech. And if they try doing the maneuver and your water breaks and you're still breech and you're a good candidate for breech birth, I've seen that actually with some of those doctors just turn into labor. And then the baby comes out breech vaginally. Other things that could happen, you could start causing contractions that we can't stop. Same thing, if the baby's still breech, you'll probably end up in a cesarean unless you're with a specialized doctor. And the placenta could become traumatized, meaning it could be sort of knocked off the wall, either partially or entirely. And sometimes the baby's heart rate just drops and, something happens in there. And if it doesn't recover quickly, that would be a true emergency cesarean.
So all of these things, like, they're really scary to me, like what you're talking about. And so it kind of brings me to this question about like home birth versus hospital birth. And because I'm sure you've been at both.
Yes.
So hospital births, the hesitation is intervention, right? Early intervention. That would probably be
that's a hesitation for people.
Main concept, but all the rest is quite safe in a hospital.
I mean, there's more that goes into the selection versus like what's safe and what's dangerous, physically and the baby. I'll give you an example. And this goes back to that fight or flight versus feed and breed mode. Somebody who just has, let me back up a little bit. When you give birth, your labor is sort of, there's a lot going on hormonally. There's 2 hormones that sort of rise to the top throughout your cycle of labor and delivery. One of them is oxytocin and one of them is adrenaline. Oxytocin is the love, bonding, and orgasm hormone, right? So it's the hormone that when your baby pushes into your cervix, it stretches your cervix, it releases oxytocin from your brain, it travels through your blood. So on your brain, it has that make you feel good and bonded feeling. It's sort of the hormone responsible for makeup sex, right? You hate somebody and then 10 minutes later you love them. And that's what oxytocin does in your brain. Like even though you're rotten, I love you. And so this baby causes all this intensity, but the more labor goes on, the more oxytocin you make, and they come out and you just love them more than anything, even though that all just happened. So that's what it does in your brain. On your uterus, it makes it contract and it helps bring the baby down. Adrenaline stops that. Adrenaline competes with oxytocin. Adrenaline is what you feel when there's a lot of fear, butterflies in your belly, a tensing of your body, a locking of your jaw, a holding of your breath, and more sensitive to pain. So let's say you're in early labor, your baby's pushing against your cervix, you're releasing oxytocin, you're feeling kind of good up here, you're feeling kind of contracty down here. And then all of a sudden, more oxytocin gets released and it's too much. The contractions become stronger, longer, and closer together because with the new dose of oxytocin, that's what's going to happen. But you become nervous because, okay, this is a lot. Then you're going to make adrenaline. And adrenaline is going to inhibit what was just happening, slow it down. It binds to the same sites on the uterus and prevents the oxytocin from having its full effect until you feel safe again. Then the adrenaline goes away, the oxytocin picks it up a notch, but you're okay. You've relaxed into that. You've eased into it. Right. And that dance keeps happening. Usually I would say at births I've been to around 7 centimeters, you have the climax of that dance where you have, I kind of call it the wall of fear. You get to this point in an unmedicated birth where it's like, oh my God, if we're at home, people are like, you guys, I don't know about this, you guys, like, I don't know if I can do this, maybe, right? And if you're at the hospital, you also see that wall of fear, like, I need the epidural now. But if you get past that wall of fear, which is a big dump of adrenaline into your system, then it goes away. Once you overcome that last piece, it goes away and doesn't usually come back. Now you hit the climax of labor. It's all oxytocin. You're feeling amazing up here. The surges are just coming and going. You're riding them like a wave. Like the difference between seeing someone in ocean waves who's terrified and tightens up, and every time a wave comes, it goes over them and they start to drown and feel like they're going to die, versus someone who's totally relaxed and just the same exact wave just rides over them, comfortably every time. So that's the difference. Now, if we can go back to, I have a patient, she had an 11-pound baby and vaginally unmedicated. And are you sitting down? She didn't even tear.
Wow.
Okay. I know that's a big deal for you.
Oh my God. Yeah.
Okay. Didn't even tear.
Yeah.
How did she do it? It was a pure oxytocin birth. And here's the kicker. It was in the hospital. I see that a lot at home. I don't see it that much in the hospital.
Yeah.
I was on her birth team. When I got to the hospital, I'm checking in at the nurse's station and I hear these noises and I'm like, what is going on over there? Like, who's watching porn on labor and delivery? And I get closer to the room, like, oh my God, that's my client, Sarah. And she's on our podcast. We talk about this story. And I just cracked open the door and she's like just in heaven with her husband, literally like dancing on him like he's a stripper pole. And I was like, you know what? I'm just going to not go in there because what could I possibly add to this? And I waited outside for about 20 minutes until I heard her say, where the fuck is Berlin? I'm like, okay. I mean, and I went in and it was just so, it never really changed from that. And she deliberately wore what she wanted to wear, surrounded herself with the people she wanted around her, had sense in the room that made her feel calm, safe, and powerful. And she just got into these crazy positions naturally and squeezed out that 11-pound baby. I mean, I've never seen a baby come out and walk around looking for a sandwich. That's what it essentially looked like.
It's interesting. You incited me. I feel like you just gave us the most epic explanation of what happens to the body during birth. And I feel like with that information, you need to feel safe. If you can find an environment that you feel the most safe in, and if you can find a birthing center or a hospital and make it feel like as safe as your home, it's like the ultimate, right? Because if anything goes wrong, you're in a hospital. But your body, if you can find home within and find that comfort and those natural responses and go inside, it's like, it's all about that, right? Without that fight or flight mode, the fear, the adrenaline. But yeah, that's really interesting. I am very neutral, home birth, hospital birth, but I would like to also go into home birth and what are the dangers of home birth as well. I know there are so many pros.
And cons,
Yeah, the pros and cons.
So I talk about pros and cons in both. Like if you have, I saw this video on YouTube of a cat giving birth. It was from like the 80s, giving birth in her closet, in a closet to these kittens, and you hear her meowing in labor. Yeah. And then the very excited pet owner gets his video camera, like the big 1980s one, and with a big light. And as soon as that light hits the cat, she jumps up. And there's a kitten half coming out of her, and you could only see her just cervix lock up around it. And she gets up and she's pacing with a kitten hanging out of her. And eventually she goes under the bed where it's dark. Yeah. And you hear her start meowing back into labor, right? Probably what happened to your cervix with that freezing cold water.
Oh, for sure.
And what happens to anybody's cervix when they're in fight or flight mode. So some people like walk into a hospital and they're automatically in fight or flight mode. Now, is that going to be conducive to a great birth? Probably not.
No.
In general, I feel like other people go into the hospital and that's their comfort zone. They feel medically safe there, and that's where they're going to be able to relax better.
Right.
And those people try to give birth at home, and all they're thinking about is what if, then they go into fight or flight mode at home.
Yes.
So there are pros and cons to both. I think that if you have a safe, healthy, low-risk pregnancy, don't live particularly far from a hospital in case you need one, and you're with good care, midwifery, or now even medical care at home, midwives are very thorough. They don't take on, clients for birth at home or out of the hospital that have factors that come up that seem risky. There's a lot of people that wouldn't do at home, and they're monitoring you constantly at home in a way that you're not really monitored at the hospital. They're looking at you, talking to you, touching you, and they know you a million times better than a nurse who's never met you sitting down the hall in a monitoring station looking at 3 screens.
Yeah.
And they tend to find things quick. Like if there's a pink flag that comes up, they don't stay at home and see, is this going to turn into a red flag or a white flag? They go to the hospital. Once in a while, there's still, for a variety of reasons, something that goes wrong at home and you have an unfortunate outcome. And that also happens at the hospital.
For sure.
And some of those people who delivered at the hospital with an unfortunate outcome would have definitely been better off at home and vice versa. So you can't say one is safe and one is dangerous. By the way, I lived in Nebraska for a while. Some of these hospitals don't even have 300 babies a year. They don't have a surgeon and anesthesiologist sitting around waiting for you to crash in your birth. If something goes on, they have to put together a team and assemble it and, meet you there. It takes time. Nobody, people who are against home birth, you could live 5 minutes from a hospital. You could be there before they're even set up for you if you had to transfer. Nobody's against Nebraska birth. Right?
Yeah.
So there's a lot of factors. You sort of, I think, have to filter out the emotional gut instinct of like, this is wrong and this is right. Everything's 100%. So binary today.
Yes.
It's not true. This is perfect for that person and this is perfect for that person. And the goal is you find out the pros and cons of both and you make the educated choice to do which one you want.
Yes.
A home birth is always a hospital birth if it's needed. And no birth is unmedicated. Either we give you drugs or you make your own.
I love it. It's just that it's like when talking about this topic, I want to be really neutral about it because there are, as you say, pros and cons to both. And I think it's more about like educating people and teaching them how to tap in to a decision for themselves that's not influenced by outside noise. It's like outside education, information, and then make a choice from within.
That wall of fear that we talked about, other animals have it too. When they're in labor, they have a moment where they stop and they have to convince their nervous system we are not in danger before the nervous system will allow them to bring that baby out, right? For them, it's no predators.
Yeah.
And for us, same thing. We have to feel very safe in order for the body to let go and let the baby come through. However, I do feel like after being at a lot of births in a lot of settings, and keeping that cat in mind, there's a huge parallel between conception and childbirth, right? The anatomy and physiology are the same. Baby goes in and comes out the same anatomy naturally. And the physiology is that hormone, oxytocin, love, bonding, and orgasm. It's the one that controls things in both settings. So animalistically, there is a sense, a drive for you to seek out the same environment that you would for conception to give birth in. And most people, if you think about it that way, would have a pretty hard time conceiving wearing an oversized unisex hospital movement with surgical grade spotlights on you. Random people coming, going, the smell of Germanside, IVs, monitors, I don't even know if most of us probably can't even do it if we tried. But that's the environment that we're asking you to labor in a hospital.
Yeah.
So if you want the best of both worlds, if you want that hospital experience for the safety
Yeah.
If you're not someone who naturally feels comfortable in that environment, there are things you can do to mitigate that and make it. You can labor at home for a long time. You can work with a monitrice who can come check medically. Remember, doulas don't do medical stuff, but midwives or nurses can come and check the baby and make sure their heart tones are sounding wonderful, and check your vital signs, make sure your body's doing great. Check your cervix if you want to see where we are in progress. With those things, you can mitigate the negative effects of the hospital and maximize the positive effects that if something were to come up, or if you're high risk, or you're not a good candidate for delivery at home. Another one is to just labor at home for a long time. That's what we're talking about, and then go deliver at the hospital when you're ready. I've had patients who live far from a hospital, and I'll do the doula work with them at a hotel across the street from the hospital.
Yeah.
And when they're ready to push, we just go across the street.
Yeah, that's amazing. I love the idea. After hearing a lot of stories, I love the idea of a home birth. Ultimately, that would be amazing if you had all of the knowledge and resources and an amazing team. An amazing team is so important, because there are cases where the team that you might have is not like what you're talking about it. So it's great that you're really informing our community of what a great team is defined as and what they should be checking. When you're at home versus hospital, do you have the technology of a hospital? I don't remember having any monitors on me or the baby's heartbeat.
They usually have a Doppler.
Yeah,
so it's
for
not
sure a Doppler.
It's not continual fetal monitoring, continuous fetal monitoring. It's a Doppler. So they listen, in the midwife training, they're every certain number of intervals where they come listen and make sure the baby's doing great.
Yeah.
There's not so much technology, but they do come with like duffel bags full of stuff. And they're very highly equipped to deal with neonatal resuscitation if the baby needs help after birth.
Yeah.
And to take care of you if anything happens to you during the birth, a medical event. So they do have equipment. They have oxygen. They generally come carrying some medications, not for labor, but for emergencies or for post-labor to make your uterus contract. And, if the bleeding's not stopping easily or the placenta's not coming out, they carry some things.
Yeah.
But certainly not the kind of stuff, equipment and teams that they have at the hospital.
Yeah.
And there's no NICU at home,
From my experience, going into a hospital felt really safe for me on the second and third, just because of the complications around my first. And I remember feeling I waited a lot until my contractions were really, really strong, because I wanted to make sure there was no unnecessary intervention in a hospital. Waiting as long as you can to go, really making sure your contractions are really consistent. And I think like the second baby I had, and the third, I pulled out myself.
Oh, that's amazing.
And I was really impressed by Cedars-Sinai in LA, because they had for pain management essential oils.
Yes.
And the lights were off. And there were like so many things because I was really into like Ina May Gaskin and those home birth theories on my first one. And I was like, when I walked into a hospital to tour, I did notice that there were more holistic, options, which I thought were really great.
Cedars-Sinai definitely went through a period where they wanted to train the nurses to support the choices that you make in childbirth.
Yeah.
Including how to better support unmedicated or lightly medicated births.
Yeah.
And, they've experimented with essential oils. Even with somebody who has an epidural, they kind of have this rock and roll method where you can sort of simulate, because one of the downsides, I think, of an epidural is that you become immobilized.
Yeah.
And if you look at other animals in labor, they tend to be on their feet walking around. It's like that combination of gravity and movement, that ambulation that helps wiggle the baby down. So they came up with this idea with a birth ball, and you're in the bed, and even though you can't feel some things or move some things, they can help you sort of simulate that ambulation and help bring the baby down. So they have definitely done a lot along those lines. And I think that's the key. Like if you're at home, how do you mitigate the medical risk and have, very well-trained midwives and basic equipment, but emergency equipment to handle the unexpected that comes up at home.
Yeah.
And at the hospital, how do you mitigate that clinical feel and that sterile environment? And one of the ways you can do that is everything you said, dimmer lights. Again, everything you would think about for conception, dimmer lights, nice scents in the room, what you wear. You don't have to wear that muumuu. You could wear something in the hospital that makes you feel strong. Like I see people wear sometimes sports clothing, like a sports bra and a tennis skirt. And it gives the doctors plenty of access to be able to get to what they need to get to. But when you look in the mirror, you don't see a hospital patient in a hospital gown. You see a strong, vibrant, healthy person expressing the strong vibrancy of life.
Yeah.
I see other people wear things that look, pretty or that make them feel beautiful, and like a sundress that just, also has a lot of access, but you look at it and you feel good in it. And it makes a big difference to that nervous system that's trying to decide, are you in danger or are you having the best time ever?
Yeah, I love that. So after all of your experience with birthing, hospital and home birth, what words of wisdom can you communicate to our community to just embrace everything that you've learned?
I would just say there's no right or wrong for a million choices that you get to make.
A gazillion.
And to just, generally speaking, find someone who is a supportive provider and a good chemistry for you.
Yeah.
There are some people who love a paternalistic doctor that tells you everything you're going to do and not do. They don't want to make decisions for themselves. That's a great doctor for you. And there's some people who want to be involved in every single decision, and that would be the wrong doctor for you. So as healthcare providers, I'm great for some people and horrible for other people. And we're all like that. Find someone who's like on the same page with you if you have that luxury. And then to just explore choices and to really, get to know what the options are and which ones appeal to you. And the final piece would just be, I think, to be a little bit flexible. So some people don't like to make a birth plan because they don't want to fail at the birth plan. There's no such thing as failing at birth, If I drive from Los Angeles to San Francisco, there's a million different ways I can go. Some people don't care. They'll just put it in MapQuest and go. And then some people prefer the scenic route and they'll plan to go that way. Yeah. Or the shortest route because they're in a rush and go that way. I always try to pass a Krispy Kreme on the way. So everybody has what's important to them. But if I'm going my route and there's a detour, I'm going to take a different route and still get to the same destination. Yeah. So once you start, it's just sort of be flexible. A birth plan should start, in my opinion, with the most sort of natural birth you want to have. That could be in the fields of some, South American country with no support around you, just you. And that's okay if that's what you want to do. Yeah. Some people want to be an elective cesarean birth. And I think that's okay too, if that's what you want to do. And there's everything in between. Right.
So be aware, be prepared, be informed.
And be flexible.
Be flexible. So let's talk about the fourth trimester, because that's something that people really kind of leave out. Do you work with people after they've given birth? I know you work with babies. Do you work with the mom too?
Yeah, so we work with babies and moms. In our practice, we have now pediatric sort of specialists that do craniosacral therapy and chiropractic with babies. And I do a lot of work personally in postpartum. It's a very big transition. It is definitely its own trimester. And there's a huge amount of change going on hormonally, physically, emotionally, responsible-wise, sometimes financially. And it's a lot to juggle with. Transitions are hard in life, even good ones. They're just challenging. And babies, if everything's going swimmingly, are still a difficult transition. And they're not always going swimmingly, so they can be even harder transitions. What I like to do with moms postpartum is soon after, in the first 4 weeks, I like to do a long postpartum visit with massage. And the purpose of that massage, if anything got, dislodged, injured, not quite right during the pregnancy or birth, that's our opportunity to fix it. Also, it's a golden opportunity where you still kind of have some of those pregnancy hormones that relax your body.
Yeah.
But you don't have the baby in there pulling on you all the time. So sometimes there's chronic musculoskeletal things that we can really have a major impact on during that golden window where you're more moldable clay. But then I do a lot of central nervous system relaxation work. So craniosacral therapy, jaw releases, hand and foot reflexology, abdominal massage, which is both very calming. You have as many nerves in this region as you do in the whole body.
Yeah.
So when you feel nervous, you sometimes feel butterflies in your stomach. The opposite of that is massaging and creating calm here, restoring warmth that you lost, and calming the whole body that way, but also moving around fluid. So like lymphatic drainage, excess fluid, helping that get out of your system.
Yeah.
And then if there was a surgery, then doing some scar remediation, working on the scar tissue.
Wow. After my birth, I had a postpartum Ayurvedic doula, which was so awesome. Like, it's so hard to find too. And like, to your point, there was Abhyanga massage, which is a warm oil massage moving the lymph, and also the binding. And I wanted to know what you think about the binding, because there's such a negative perspective on snapback culture and waist trainers. But what about the ancient ritual of binding, right? And it's like, if like with BUMPSUIT, we have a support waist trainer. It's not a traditional, like, it's not for snapback culture. It's literally a compression band that it just, you're like jelly after you give birth. You have no core support. You have no core muscular system. So it's like really just helps support during breastfeeding. You can put it on right after birth. It's not aggressive. We tried to create it to model the binding ritual, which I became aware of with the Ayurvedic postpartum doula. And that is kind of a difficult process. So we're like, how do we replicate this? But what is your perspective of postpartum binding?
Yeah, it's not about the snapback culture, really. As with everything else, there's some people who are going to do great with binding and other people who won't. But I'll give you one example of the power of binding. And that had just happened this week, just yesterday in my office. 1 week ago yesterday, I had a patient who delivered quadruplets.
Wow.
And she recovered from, it was a cesarean birth. She recovered from the cesarean really well. She would try to get up and she couldn't walk. Her back was killing her. And I had to wait a few days for her to recover from surgery before I can see her. And what she realized during the days that she was waiting, she took out her old binder and put it on, and she was able to stand up. There was nothing holding her, like her contents, her abdominal contents in.
Yeah.
And she needed that support to literally be able to stand up without excruciating pain.
For sure.
That's an extreme example, but I would say most people in my practice who do some kind of binding afterwards, after having the baby, are very, very happy that they did it. And for some of them, it's about snapback and getting my body back the way it was. And for most of them, it's about taking care of my body, giving my body some support and tools while I go into this next stage where I'm constantly bending, holding, feeding, changing, lifting, and don't have all that much time to take care of myself. Yeah,
100%. I think, you know, I wish that I had this product for the first baby and the second baby, because I was like really hell-bent on snapback culture. And like, but then when I learned about the Ayurvedic binding and then we tried to replicate it, I was like, wow, it's literally like a superpower for moms, because you lose a lot of weight during birth and you feel like you're going to fly. You feel like you're going to float into the air. And so you need something to ground you. And also the feedings in the middle of the night, multiple times. It's like you need something to support your core. So I'm really grateful for products like these and awareness that it's not snapback culture. It's actually an ancient form of supporting mama.
Yeah, postpartum support and healing. For the most part, I think it's a great thing to try out.
We always recommend for our community to buy a couple of them, like one that's bigger for a more relaxed, you could sleep in it, and then one from when you're more active, a smaller one.
Smart.
At the end of every session, we do kind of like words of wisdom from you based on your whole experience. It could be something related to childbirth, something completely unrelated, something related to your practice, something valuable to pass on to our community that might help them on their journey.
I mean, my whole life is get informed, you know. Unless you're someone who hates information and decision making, get informed. It's never too early to start. Gathering information, learning about things, exposing yourself. Most people are not exposed to childbirth at all, except for what they see on TV, movies, and newspaper headlines. And if you've never flown on an airplane, and now you're 30 years old and you're going to go on your first flight, but all you know is what you see on TV and movies and newspaper headlines, you'd be terrified. Like, we'd literally have to knock you out to get you on that plane, because the assumption is that all planes are either going to, you know, have mechanical failure and fall out of the sky, or be hijacked by terrorists, or have snakes on it. Like, the idea that a plane just takes off and flies and lands, even though that's what happens almost every flight, every day.
Yeah.
And pregnancy can be great. It doesn't have to be all the negative things that you hear about it. Birth can be the most amazing, transformative thing that ever happened. It doesn't have to be horror story. And postpartum also. All of these are challenges and hurdles, but you are born with the tools and the hardwired information to do them, and to do them the most efficient way possible. The body's hugely efficient. There's no pump in the world that can pump 60 to 100 times a minute for 100 years without maintenance. You know, there's no filtration system nearly as efficient as the human kidney. And childbirth is the same way. Your body does pregnancy and birth really, really well.
Yeah. And so, speaking of getting informed, where can we find you? Where can our community find you?
I am online at informedpregnancy.com. We have our podcasts there, the Informed Pregnancy Podcast. We have a streaming service, informedpregnancy.tv, with movies and web series, and comedy and meditations and exercise programs. We're about to put up belly dancing, all for this time of life. You know, fertility, pregnancy, birth, postpartum, and parenting. And on Instagram, at Dr. Berlin, DoctorBerlin.
And if you're based in LA, you can go see him in person.
Come by. The party is happening at all times.
To end our episode, we do a segment called Bumps in the Road, where we pay it forward to a mother in need. And we've asked you to nominate a mother in need to pay it forward. A little gift to our mamas out there from BUMPSUIT.
So I thought about this, and my mama that I think has a bump in the road is the one who just had quadruplets.
Yeah.
A really big bump in the road. Although now she's just, a week later, she's binding.
Yeah.
And she's really compressed. She is an amazing person. She started off, it's an interesting fertility story that started off with an IVF where they put in one embryo, and she got pregnant with 4 babies.
Get out of here.
Long story short, there are no identicals. So she naturally somehow conceived at least 3, if not 4 babies in that IVF cycle. Meaning either the one she put in took and she conceived 3 on her own, or the one she put in didn't take and she conceived 4 on her own. And that's after years of trying to get pregnant, not being successful.
Wow. It
is a weird, bizarre story. And then she had to decide, you know, do I keep all 4 or do I reduce this pregnancy? It's just an emotional challenge like none other. And then when she couldn't bring herself to reduce them, she's like, no, I'm going to be positive and say that they're going to be healthy and I'm going to be healthy. And she carried them to almost 35 weeks and had a scheduled birth. She's an amazing inspiration to me, and I'm sure right now she can
use a little bit of
love.
Yeah.
And she's my big bump in the road.
Awesome. We'll be happy to serve and help her out a little bit.
Thanks, Nicole.
So thank you for that. We really appreciate it. And thank you for coming on the podcast today and sharing your wisdom and knowledge.
My pleasure. My only thing, if I could make one request of you, I think BUMPSUIT for men.
Hey, we have Cloud. Men's Cloud. It's loungewear.
I'm
we
going
have
to
to
go check
send
it
him
out.
some.
I need some Cloud.
We'll send you some. It'll be cool. We will also send you some of our support waist trainers. It's not like it's just a compression band. And just to get your opinion on them and see
I love it.
what you think with your clients, anyone that needs it.
Absolutely.
We're here to serve, Dr. Berlin. We're here to serve.
Thank you
That's
so
what we're
much.
here for, as are you.
Teamwork.
It's like use this company as a vessel for change because we're not just here to go cha-ching. We're here to change and impact this world.
Cha-change.
Cha-change. Cha-change. Love it. Thank you.
Thank you.
Thank you for listening to the Village podcast, normalizing conversations and experiences in pregnancy, childbirth, postpartum, and motherhood. We are here to serve, and we really want to hear from you. So feel free to share, comment, like, and subscribe to keep this village growing. We are eternally grateful for you being with us and sharing space today.